My name is Erica Romero. My presentation is on the opioid epidemic, what exactly that is, the effects that has, and if there's anything that we can do to stop it. First of all, I think it is important to give you some background on why I chose to research the opioid epidemic. It has to do with the work that I am in. I'm a family support worker with St. Francis Community Services, which is a foster care organization for the state of Kansas. The Department for Children and Families in Kansas stated that in August of 2017, there were 7,192 kids in state custody. Another reason that I'm interested An opioid is a type of drug that bonds to the receptors in your body to decrease the feeling of pain and increase euphoria, a very good feeling. There are three main types of opioids, and they include things like prescription pain medications as well as illegal substances like heroin. The three main types of opioids would be natural opiates that are made from the sap of a poppy plant. That includes things like morphine as well as codeine. Then there are semi-synthetic opioids that are made from the sap of the poppy plant but changed in a lab, and that includes things like hydrocodone as well as heroin. And then there are 100% man-made opioids, which includes things like fentanyl and tramadol. The opioid epidemic has some alarming statistics, and I will talk to you about the difference between the abuse of opioids as well as overdose of opioids and their statistics. Overdose is known to be the leading cause of injury death in the United States. 116 people die every single day from an opioid-related overdose. It is said that about 40% of all overdoses on opioids are because of prescription medication. In this graph, you can see that the number of overdose has dramatically increased since 2002. The opioid epidemic does not just include the number of people who have lost their lives from overdose, but also those who are abusing opioids. The American Society of Addiction Medicine reported that 1.9 million Americans were addicted to prescription opioids in 2014, and that does not include those addicted to heroin, the illegal form of opioids. Lewis Nelson, MD, one of the citations from my annotated bibliography, states that opioid poisoning is the second most common poisoning in a North American emergency room, only following alcohol poisoning. The National Survey on Drug Use and Health states that non-medical use of opioids is down, but the use of prescription opioids is higher than in previous years. The Lewis Nelson article also talks about heroin as a cheaper option to prescription pain medication. So now, after some of the astonishing facts about opioid use, the question comes, what can we do to prevent this? What can we do to stop this epidemic from spreading? What can we do in our communities to make a difference? Naloxone is a prescription that reverses an opioid overdose. It does this because it is an opioid antagonist, and it is able to knock the drugs out of the opioid receptors in the central nervous system. Naloxone is administered via shot. There's also a name brand called Narcan, which is administered via nasal spray. In 2015, the CDC reports that 26,000 overdoses were reversed with the use of naloxone. It also says that since 2011, the amount of naloxone distributed has doubled. One of the best and simplest ways for prevention that may lower some of the tragedy of the opioid epidemic is simply support and awareness. The crisis needs to be talked about. There needs to be more prevention and outreach programs to heighten the knowledge of the issue at hand. People need to realize this is a real life issue. It needs to be faced head on. There must be a higher standard for treatment centers, as well as improvement to the health insurance coverage of those treatment facilities. It is also very, very crucial that we humanize this epidemic. This is something that can and does happen to anyone. We cannot let it be that it is not an issue simply because they are taking their prescription. If they are taking it when they don't need it, or outside of how it is intended to be used, they are abusing it, and they themselves have an issue. The Harvard T.H. Chan School of Public Health reports that 40% of people personally know somebody who has abused prescription painkillers, and that is only those who have voluntarily reported that they are using painkillers or have used painkillers. So that pretty much means everybody knows somebody. Almost half of everybody knows somebody personally who has used a prescription painkiller in an inappropriate manner. That is a real life issue. That needs to be talked about. That means people need to know it is okay to ask for help.